That's a very serious subject, and we are beginning to get into the realm of how do we approach people who are struggling with substances, which it's a very serious disease when it gets to the point where they are dependent. When the dependence occurs, in the general population, they commonly call it addiction. At that point, it becomes a disease, and that's when they need help. But one of the greatest problems with people who are addicted to substances is they always deny how much they use. And it's not deliberate. They just minimize the effect. And because of that, they are not willing. Sometimes people, or even their provider, or medical providers, are telling them, hey, you are having signs of addiction. And they minimize it because they don't believe they are struggling with it. So one of the common ways we get them to start talking about it is what we call motivational interviewing, which has about 4 different steps. And we have to figure out first where the person, which stage of change this person is. And the very first thing is to help them acknowledge that the use of this substance has become a problem. And that's when somebody is still at the stage of pre-contemplation, which is the very first stage, meaning they don't even acknowledge that they have a problem, even though the problem is affecting them. Most often we see people seeking the drugs to the point of going to the doctor to get a prescription just because it makes them feel good. This time around is not the drive, but it is actually the fact that they stay healthy. Without the drug, they are feeling sick. And so they keep asking. And when you're trying to tell the people or this particular individual that this has become a problem, they don't see it. All they are looking for is relief from the sickness that is coming from the absence of the drug. And so we try to use various techniques, to help them move from the stage of pre-contemplation to the stage of contemplation. At the stage of contemplation, that's where they begin to understand that, hey, this is actually hurting me instead of helping me. Even though I feel good with it and I feel sick without it, but if I continue this way, I may be able to, it may hurt me to the point of no return. And at that point, they're beginning to think, okay, what can I do to get help? And then we move them to the next stage. Once they master this stage, then it's easy to move them to the next stage, which is the stage of preparation, where they are considering the options, weighing the options. What do I do? Do I take medications? Do I go for this or that? And then action. After they have fully evaluated all the available resources and they decide to do something, and then we can move into the stage of action. And then, of course, the last stage is the stage of maintenance. Moving through these stages doesn't happen in one day, and it can take months, several weeks on even one stage.